Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about what a congenital diaphragmatic hernia is, as well as what it looks like on ultrasound. Now, a CDH is when there is a defect between the abdomen and the chest, basically a defect in the muscle that separates them. And when there is that defect or that hole that is present there, we call it a hernia. So, as you can imagine, when there is a hole between the abdomen and the chest when there isn't supposed to be one, problems can definitely arise. Specifically, those in lung development as well as some heart issues can also develop. And depending on what is herniating up through the hole into the chest, it can also cause issues with the organs that actually go through this hole. One of the things that can happen is bowel can actually go up into the baby's chest, and not only does it affect lung development on that side, it also affects lung development on the other side. So, let's say, for example, there is a hole in baby's diaphragm on the left side. The bowel may go up into baby's chest on the left side. Therefore, the left lung will look smaller and be underdeveloped. But unfortunately, that will also affect the lung on the right side for development. This can be an issue for baby after they are born and they end up having breathing issues. So not only is lung development affected, but let's say when the bowel goes up into baby's chest, the bowel can also be affected, as in when it is not developing in the correct spots in baby's abdomen and not making those correct connections. It will then malrotate, and in some cases, it can also twist on itself so much that blood supply is cut off, and then that part of the bowel actually ends up dying off. So, depending on the severity of the CDH case, that is what is going to determine the symptoms the baby has, as well as what the treatment will be after birth. Some cases are super mild and there are little to no side effects to baby, but in other cases where there is a larger hernia or a larger hole and more structures are affected, then unfortunately there will be a higher chance of having complications after birth, including needing surgery to actually close that hole up and also to get the organs back where they need to be. On ultrasound, we are going to pick this up at the anatomy scan in most cases when we are looking at the diaphragm and seeing if it is in the right spot and making sure that the structures are in the right spot in the long axis view that we do on baby. But unfortunately, some cases aren't picked up until after baby is born and they start having breathing issues, and then they start to investigate, obviously, where those breathing issues are coming from. And for many cases, we cannot find the cause for it, unfortunately, unless it is part of a underlying genetic condition, in which your doctor may suggest further genetic testing just to find out what that condition may be. And if you are diagnosed, then a fetal echo will most likely be ordered as well, just to ensure that the heart is not affected. And also a fetal MRI may also be suggested. So I thought this is a good illustration before we get into a few ultrasound pictures in what a CDH is in a baby. Over here, you can see this is a normal baby, and over here is a baby with a CDH. So the diaphragm over here, I think I'm covering it up, but anyways, so it says diaphragm over here is what separates the chest from the abdomen. Now, in a normal baby, you can see that the intestines, the liver, all of the stuff that is supposed to be in the abdomen is in the abdomen, and the lungs and the heart are in the right place up in the chest here because this diaphragm here is intact. As opposed to on this baby here, you can see that the diaphragmatic hernia is actually on the left side of baby here. And way over there on the other side of baby, you can see that the intestines are actually herniated up into the left side of the chest, and therefore it is affecting the shape of the left lung. And although this right lung over here is preserved in shape and is not going to be affected growth-wise, both lungs will be affected in the way that they function. This is the short axis of a chest on a baby in utero. So here we can see that the heart is over here, but it is being pushed off to the side by the gallbladder, which is labeled on the far side over there, as well as the bowel. And you are not going to normally see the bowel and the gallbladder up by baby's heart on a normal baby without a CDH. These structures are coming up from the right side of baby's body, so that means that this is a right-sided diaphragmatic hernia, and therefore it is pushing the heart off to the side. And again, in normal babies, we would not see all of this extra stuff over here. We would only see the heart. And once again, you can see that this is another short axis on baby's chest, where you can see not only the heart up over there being pushed off to the side, but there is also the liver, bowel, as well as the right lung that you can see over here. And everything in the right side is being pushed up into the chest from the abdomen, as in the bowel and the liver. And again, that is not normal. That should not be there. And it is only up there because of that hole in the diaphragm. And therefore, the contents of the abdomen are actually being pushed up into the chest.